Hi, my name is Jeff, and I'm a licensed occupational therapist. And part of my job is working with caregivers, such as family members or friends like you, to train you all in preparation for bringing patients home. I also support and provide you guys with the tools needed to be a caregiver, whether temporary or for the long term. So, if this sounds helpful to you, subscribe to this channel for more content. I'm Jeff, the OT dude, and let's get functional. So why do caregivers need training in the first place? Why can't you just roll up to the parking lot and pick up your friend or family member and just bring them home? After all, they should be going to home because they're safe to go home, right? Well, while this is often true and true to a certain degree, this is not always the case. Just like how patients get paperwork when they go home from, say, the doctor or the team for how to manage their condition, the same applies for caregivers in terms of needing training. And there may be many reasons why patients end up going home too. In the American hospital system, the number of days that patients stay in the hospital is decreasing overall. Other times, families just want the patients home, so that is a good thing. But whatever the situation is, the reality is that you will be the caregiver. And to answer the question of why training is needed is safety. Just like how new parents have to prepare their home like I did for my newborn, or if you're like adopting a pet and you have to make the home safer for the newborn or the animal, whatever type of animal it may be, like a lizard even, the same applies to the patient who is now coming home. I am not saying to infantilize the patient, of course. You should treat them as a person, whatever their age, especially if they are elderly. But as we therapists and the rest of the hospital staff are trained on how to work with the patient in terms of safety, such as them getting out of bed or helping them to walk or to get dressed, suddenly they go home and it may be a different environment, even if it's a home that they're familiar with, or they may sometimes even go to a relative's home temporarily, such as if they lived independently before, and now they may be living at a relative's temporarily before they can go home. So caregiver in a new environment, right? And also some things may be different about the patient, like physically or even mentally, such as after a stroke, patients may now have, say, weakness on one entire side of their body. They may be slower to think. They may be more forgetful. They may have poor balance. Or believe it or not, they may even ignore one whole side of the body as if it didn't exist after a stroke. With all this said, before I get into the practical hands-on training, which will be in future videos, I thought it was important to talk about some background things as a foundation as a caregiver. And it's important that you don't skip this video because learning these concepts and approaches is very important, and not knowing about them or not remembering them can even literally result in physical harm to both you and or the patient. And you don't want a situation where you may end up having to call 911 again because, for example, you guys fell or there's an injury and there may be rehospitalization. Being a caregiver, first of all, is not easy. It can be very demanding, physically, mentally, emotionally. I can kind of relate as a new dad, as I have had to make a lot of sacrifices myself and to do the things that I need to do for my kid instead of what I want to do myself. And I am still struggling with this, like trying to find time to make videos. It's not easy. You may have to run on someone else's schedule, including their sleep habits and even their meal times. Being a caregiver can also be very rewarding. Watching someone get better or them just being happier overall, just like a caregiver for a child or a pet, right? Someone else's recovery, and I could even say their life, depends on you. And you guys may even be put in a situation where you may have had no choice to become a caregiver, such as being the only available one for the patient. So I understand that you may not have necessarily volunteered to be in this situation. Either way, I like to look at things on the bright side, and I encourage you all to do the same. The second is to take care of yourself whenever you can. This could even mean just taking a minute to breathe or to sit down and to rest or relax. I know it sounds like that's impossible sometimes when you're a caregiver, but there are times where you can take short breaks. So nap when the patient naps, or eat when the patient eats, or snack. If possible, try to find some respite by having someone else relieve you of your caregiver role, even if it's for 15 minutes. That could be all you can need to recharge and relax and regather yourself. This could be a friend or a neighbor or anybody else who is a reliable person that you trust. And you could even take more creative approaches if you have, say, no one to give you a break from being a caregiver. For example, with the patient's permission, of course, you can say have like a baby monitor set up so that you can keep an eye on them, and so you can step outside the door and get some fresh air or something while they're napping, for example. The third suggestion for being a caregiver is communication, I think, with the patient. I think this goes without saying, but it's worth emphasizing because communication may change in the communication ability of the patient. And so they may or may not be able to communicate their needs to you, and vice versa when you try to communicate with them. They may require more patience, for example. You may need to even do things like use simple gestures or even write down what you want to say, or they write down what they want to say, because there may be difficulty with expressing words even. So this is similar to how you may need to speak the language of a child, or how when you have a new puppy, for example, right? You have to kind of speak their language. Same goes for the patient as well, as they may even get easily frustrated, with all this disability and changes in their body. Communication is another thing that can be frustrating for them. So it may take some time getting used to, but also having patience and not getting easily frustrated and just allowing some time, as long as you guys are both safe. Communication is also important because you want to be on the same page too when you're helping the patient with a certain thing, like helping them get up. For example, you should both discuss beforehand what to do if some things were to happen, such as when you're helping the patient get up and they're too weak. You don't want to be in a situation where you're like helping the patient get up and like putting in all this effort, and the patient is just like giving up and like not and trying to get up, and you're kind of like going against them. So you want to be in the same page in every type of scenario if possible, to be efficient, but also to be safe. Like what you will both do, for example, if you're like walking to the bathroom and then suddenly what are you going to do if they feel too weak and they cannot take another step? If you communicate really well, then it saves a lot of effort, energy, maybe even pain, right? Because the patient may be in a lot of pain, and a lot of pain on your part too. I'll talk more about this type of exact situation in a future video. The fourth tip, I think, is to take your time in order to be safe. Don't rush. Like if the patient has to go to the bathroom, yeah, this is a very rushy kind of situation, but try not to rush, because yeah, it would be nice to avoid an accident, but what is worse, right? Having an accident and then having to clean up, or having the patient like fall or get injured and having to call like the ambulance, right? I would rather have the accident and clean that up and have nobody get hurt. And then the next time we can figure out how we can get to the patient safely without having the accident, and problem solving from there. And when I do family training with patients and their friends or other families, I like to say that planning should take just as long, if not even more time, than the actual part of helping the patient, like walking them to the bathroom, for example. When you take the time to plan ahead and even like visualize in your mind the steps in your head, it can actually save you a lot of time and effort at the very least, if not to avoid an injury or more pain. Take, for example, when I've been talking about going to the bathroom and helping the patient. Let's assume that there's a chair in the way and you don't take the time to notice that or plan what to do beforehand. What you could do if you were to plan ahead of time is to move the chair out of the way and then help the patient. But if you didn't do that and you jumped right in to help the patient get out of the bed, and then by the time you see the chair, the patient may be trying to rush, or you are kind of pretty much left with two scenarios. One is to help them back to where they were, like back to bed, and then move the chair out of the way, which is the safer option, by the way, or to let go of them if they need like physical assistance like for balancing, and then you risk having the patient fall while you move the chair, right? So you don't want to be stuck in a situation where you're like maybe stressed, patient may be like anxious, And during those stressful times, we all know that when people are under stress, especially when other people are like in pain, it may not necessarily be you, it may even be the patient. We may not all make the best decisions, and that can result in injury or harm. So you see how just taking 1 minute even to plan ahead, not only to what to do when you get the patient there, but I like to say what to do afterwards when you get the patient back. How can you plan so that you can make both of your lives easier is the best thing to do if you can remember to do so anyways. So in summary, being a caregiver and caregiver training really is essential to ensure the safety of both you and the patient. Being a caregiver can be demanding, but it is also a very rewarding role as you can see the patient recover or to continue to live their best life with your help. The birds agree with me in the background there. So take care of yourself whenever you can, both physically and mentally. Try to be patient when communicating with the patient, and this may even mean finding new ways to do it to communicate with them better. Last is to take the time to plan ahead before taking any action, such as removing obstacles, grabbing the supplies you'll need before and after, and taking the time to communicate and review with the patient what you're about to do and what to do in certain situations. Safety should trump everything. Hope this helps. Thanks for watching, and I'll see you all in the next one.